Today, we're going to talk about all the treatment options for erectile dysfunction. This is our Mayo Clinic Men's Health team here in Rochester, Minnesota. We specialize in all things related to sexual medicine. My name's Dr. Sivan Hilo, and I'll be narrating this video for you. We've created this video to go over all of your options ahead of time so that we can spend your appointment discussing the option that you are most interested in to make the most of our time together. So first up are oral medications or pills. These include medications like Viagra, Cialis, Levitra, and Stendra. I tell patients that these medications all work very similarly but have slightly different side effects. This can include headache, dizziness, facial flushing, indigestion, and muscle aches. Now, Viagra and Cialis are both generic, which means that they're very affordable and shouldn't cost more than $20 a month. Now, what's the right way to take these medications? First up, you'll want to take them 30 to 60 minutes before having sex. Viagra should be taken on an empty stomach, as fatty food and alcohol can affect absorption. Keep in mind you're going to need all the normal stimulation it takes to get an erection. And these medications may not work quite the same way every time. So what if you've tried them before and they didn't work? Well, don't give up just yet. You want to try the medication 5 to 6 times under optimal conditions at the maximum dose before moving on. Viagra, maximum dose is 100 milligrams, and for Cialis, the maximum is 20 milligrams. And if it doesn't work for you the same way every time, it may be the time to move on to the next option. Now, getting a prescription. You can ask your primary care physician for a prescription and then use a website like GoodRx.com or CostPlusDrugs.com to get the best deal. Most patients will buy the medication out of pocket rather than bill through the insurance. If you've tried Viagra and Cialis at the maximum dose and they're not working, that may be a good time to make an appointment with a urologist like me to discuss options other than pills. So next up, we have a vacuum erection device, or sometimes called a VED. Now, a vacuum erection device, it is not what you're thinking. A vacuum erection device is actually a device that has a cylinder that goes over the penis. It's connected to an electronic pump that helps draw blood flow into the penis. And once you get an erection, you'll quickly put on a constriction band on the base of the penis to help trap the erection. The nice part about a vacuum erection device is that it's not a medication. There's a single one-time upfront cost, and for some patients can improve penile length by stretching the tissues. I almost think of it like physical therapy for the penis. Now, that being said, there are disadvantages, including the cost. It can be expensive for a good medical grade quality device, and a lot of patients say it lacks the romance and spontaneity that they would prefer. Now, you can buy one of these devices online without a doctor's prescription and try it at home. Next up is penile injections, also known as intracavernosal injections for the penis. Yes, you heard me right. So hold up. These are injections that you will do every time you want to get an erection. They're not painful. Most patients say they can barely feel that needle going in. It's a tiny, like insulin type needle. You'll inject directly into the side of the penis or you want to get an erection. So what else do you need to know? Well, if they work for you, they'll kick in within about 10 to 15 minutes, with the goal being an erection that lasts around 30 to 45 minutes, depending on your dose. Like the pills, the injections may not work quite the same way every time. So what else do you need to know? Well, a couple quirks about the injections. One is that the medication does have to be kept refrigerated, otherwise it loses its efficacy. You also will need to purchase it from a compounding pharmacy, which is a specialty pharmacy that makes the medication for you. And it has a tight expiration date of about 30 days from the day that it's made. Cost for the injections is around $150 per vial that will give you 6 to 7 injections for the month, depending on your dose. Got all that? Good. All right, so let's keep going. One more thing. What if none of those options work for you, or you don't want to try some of those options? Well, don't worry. We've got something else. So the last option we'll talk about is a penile implant, which is a permanent surgery for the treatment of erectile dysfunction. Now, I know what you're thinking. Surgery, that's crazy. I'm not going to do that. And that is every guy's first reaction. But hear me out. So a penile implant works with 2 cylinders that are placed inside of the penis that fill up with fluid. That fluid is saline. It's like the stuff you get through your IV when you go to the hospital. It's contained within the reservoir that is stored either in the pelvis next to your bladder or underneath the muscles of your belly. If that fluid ever leaks out, your body will just reabsorb it, and it's not dangerous to your health. Now, inside of the scrotum is a pump that you'll squeeze when you want to get an erection. For most guys, that's going to take about 10 pumps to pump up the device, and you'll be able to do that within a few seconds. And then there's a deflate button when you want that erection to go away. Now, don't worry, all these pieces are on the inside, so we say it's locker room proof. No one would know you have it unless you told them. And it will give you an erection anytime you want, every time you want, for as long as you want. So that's a game changer for a lot of guys. It's the most reliable option of all the things we've talked about, and over 80% of patients say they're satisfied and would recommend it to somebody else. But it is a surgery, so once you get an implant, you can't go back to something else. So you want to be sure that this is the right option for you before proceeding. Now, what else do you need to know about surgery? Well, it's typically an outpatient, same-day surgery. It's covered by most insurance companies, including Medicare, so for some patients it's more cost-effective. But surgery is a big deal, I hear you. So at your appointment, we should sit down and talk about the risks and benefits and see if it's a good option for you. Now, with all the treatment options we've discussed, I guarantee that we have something that will work for you. It's just a matter of how invasive that's going to have to be. Now, wait a second. What about these shockwave treatments or P-shots I've heard about advertised on TV or on the internet? Well, shockwave therapy is a type of ultrasound therapy that's aimed at regenerating damaged tissue that can be causing erectile dysfunction. Some studies show it may be effective for men with very mild erectile dysfunction, but it's definitely not ready for prime time, should only be offered in a clinical trial setting, which means that patients should not be charged for these treatments because they have not been proven to consistently be effective. We currently do not offer these treatments at Mayo Clinic. Now, what about P-shots? P-shots are also known as platelet-rich plasma, or PRP. This is where a patient is injected with their own blood components to help promote growth of penile tissues. There is insufficient evidence in humans to recommend this, and patients also should not be charged for this kind of treatment as well. This is currently something we do not offer at Mayo. So, in summary, we have lots of treatment options. You just need to choose the treatment option that best fits your lifestyle and something you'd be willing to do. So I guarantee we have something that'll work. And unfortunately, some of these newer treatments are just not ready for prime time. We look forward to meeting you at your appointment. Feel free to check out our website with more videos related to these things that we've talked about using that QR code on your screen. You can call the number provided to schedule an appointment, or visit our website online where you can read about a lot of the things we've discussed today. Thank you very much for your attention.